Good morning, Rosa. How are you? All right. Well, good morning, everybody, and welcome
Good
to the
morning.
LifeCare 2022 Open Enrollment. This is for the plan year of October 1st, 2022 through September 30th of 2023. I'd like to welcome everybody here today. I hope everyone will enjoy this presentation as we go through it. Keep in mind, if you didn't hear already, this is being recorded so that we will have a recording of this entire presentation that can be shared with everybody later on. And with that, let's go ahead and get started. Okay, So for the LifeCare 2022 benefit package, you'll see up here on the screen, these are the benefits with shared costs between LifeCare Assurance and you, the employee at LifeCare. You'll see that we are offering a very robust package of benefits. We have, for the medical, we have both Anthem Blue Cross. Anthem Blue Cross provides HMO, PPO, HSA, and this also is for anybody outside the state of California. You would be selecting one of the PPO products for outside the state of California. Then for California, we have Kaiser Permanente that offers a HMO here in California. Once again, this is only for employees in the state of California. We have MetLife for your dental, and we have both a DHMO and a PPO plan. Then for vision, we have Anthem Blue Cross for your vision plan. And these products, medical, dental, and vision, there are no changes whatsoever on these plans. Then we did introduce this actually earlier this year. We switched over from I'll just say another company to Sun Life for your life and AD&D. Then you'll see here, these are benefits also provided at no cost, and that is, again, Sun Life for your life AD&D. Sun Life is now your carrier of choice for your employee assistance program, also your long-term disability with Sun Life, and short-term disability. I will make a note on the short-term disability. This was something that was just added last year. And essentially, this is for all the non-California employees. Now, before you get upset that why didn't I get it in California? Essentially, what we did is we just added what is known as a SDI. That's short-term disability insurance that everyone is mandatory. It's a mandatory item that for every employee in California, you know that you get a little deduction out of your paycheck, and that covers your state disability. So what we simply did is we mirrored that plan so that everybody outside of California has the same exact benefit for the same exact benefit that people in California have. So, all right. Then for your voluntary benefits, we have, again, Sun Life took over the voluntary life and AD&D. So you have that now with Sun Life. Now, this, I want to remind everybody, and I'm sure a representative will be telling you this. This is an opportunity that we set up that for this open enrollment, you have a special open enrollment in that you'll be able to sign up for the voluntary life insurance without any medical underwriting. This is a one-time opportunity this year to be able to sign up for the full guaranteed issue without any underwriting. When we move forward, just like we had in the past, next year, you'll be able to increase it, but you won't be able to just sign up. If you haven't signed up for the voluntary life, you won't be able to sign up next year without going through medical underwriting. So keep that in mind, take advantage of it if you can. Then no change for the flexible spending account, and also includes dependent savings as well and car savings account. So that's all available through PayFlex. Then pet insurance, no change with that. That's through Nationwide. And Legal Shield still provides you with Legal Shield and ID Shield, and no changes with those benefits as well. Also on the voluntary benefit side, we have Trustmark offering accident insurance, and we just introduced this last year as well. You also have the universal life with long-term care. This has been a very popular product because, as you know, everybody needs and should have long-term care. I'm just going to throw out one thing, and you guys are lucky that you have this, because in probably a year or two from now, the state of California is going to make it mandatory, is going to have a mandatory long-term care plan for all employees in the state of California. What I can tell you is it's not going to be that good of a plan. And you're going to be much better off with the Trustmark with long-term care insurance. So anyway, more to come on that later, but I just thought I'd mention that. So this is your open enrollment period. It's very important that you complete your benefit elections and changes during this period. If you miss the opportunity to do so, you're not going to be able to really enroll or make any changes until next year's open enrollment period. So after open enrollment closes, the only exception to enroll in the plan year is if you have a qualifying event. These are just some of the qualifying events listed. As an example, if you add or remove a dependent in your household, in other words, if you have a new baby or an adoption, or if one of your kids moves out and you don't want to cover them anymore, if you get divorced, something like that. So anyway, these are some of the things that you can do to update your enrollment throughout the year. And also, you want to make sure you select update your benefit plans when you go on to your intranet. You want to make sure you update your personal information, make sure you have all your personal information listed correctly, primarily your address, and then also verify your life insurance beneficiaries. So make sure that you have the correct beneficiaries listed. Some of us may have gotten divorced and remarried, and that's obviously a good time to update that, is to make sure you updated your beneficiaries. We're not going to go over this during the presentation, but everybody has access to Airbo again this year, and you should have received a flyer that you can go into Airbo, and you'll be able to essentially look at all of your benefits in Airbo. It makes it very easy to go in there. Who is eligible for benefits? Well, basically any full-time employee that works for LifeCare is eligible for benefits, and then your biological children, stepchildren, adopted, foster kids, and your spouse or domestic partner are all eligible to be on your plan, and then they all have their contributions associated with them. Just an important reminder: if you miss the opportunity to enroll yourself or your benefits, you will not be able to do so until next year's open enrollment. Hopefully we've made that very clear. So make sure you pay attention, and make sure if you're going to enroll or make any changes, that you do so during the time that you're allotted during this open enrollment period. Actually, I just went over all these qualifying events. These are just some examples. You'll also find these examples on Airbo as well, as we listed them. So you'll see here birth or adoption, death of a dependent child or spouse, you get married or divorced. So these are all basically examples where you can make a change during the year. Other than that, you have to wait until open enrollment next year. All right. This is Kaiser Permanente. So Katie, are you there?
I am. Hi, everyone. I'm
All right.
Katie. A representative with Kaiser Permanente. So I'll be going over today your plan benefit and as well as the resources that are available with your Kaiser Permanente membership. So let's go ahead and begin. So it's easier to find a healthy place with a connected care. So for those of you who don't know, at Kaiser Permanente, we're known as an integrated care. So what that means for you as a member is that we combine caring coverage and we make a lot of things easier for you to receive all the services under one roof. So for example, you can see your doctor, you can see your specialist, you can go to the pharmacy to go get lab work done, and everything all in the same visit instead of going from one location to the other. We save you that time. In addition, the doctors and the specialists and nurses, they all have access to your electronic medical records. So everyone is on the same page when it comes to your health. So at Kaiser Permanente, we want to make sure that you have access to great quality care. So once you choose your doctor, which you can choose your doctor based on what's important to you, whether it's you want a female doctor, you want a doctor that speaks a certain language, you can do that on kp.org/search doctors, and you can read a short biography on them, and you can look for a doctor based on what's important to you on the different criteria. Once you choose your doctor, they'll make sure that you're on top of your preventative care. If you need to see any specialists, they'll connect you with a specialist. And if we can go back to the last slide, please. And if you need any ongoing support for any ongoing conditions, they can also support you with that. So for example, if let's say currently you're with another carrier and you have high cholesterol or diabetes, those are great conversations that you can share with your Kaiser Permanente primary care doctor. They'll make sure to support you with that. Next slide, please. So we also offer mental health services. We know how important that is, and we want to make sure that you're aware that you have access to mental health care at Kaiser Permanente. You do not need a referral from your primary care doctor. You can self-refer yourself and make your appointment on kp.org or by calling member services. You can connect with a psychologist, like psychiatrist, marriage and family therapists, counselors, and so much more. There's support for a wide range of different conditions like anxiety, depression, substance use disorder. And we have a lot of different resources to support you with these mental health So if you want to take a class on how to cope with anxiety or depression, or you want to be part of a counseling group, we have all those resources available for our members. We also want to make sure that our members have access to care conveniently. So not only can you see your doctor in person, you can also have a video visit or a telephone appointment with your doctor at no cost. Also saving you some time. You can have a telehealth appointment from the comfort of your home or during your lunch break. And this is a great appointment for anything that does not require you to be there in person. So for example, maybe you have some allergies or you've been having a cold for a few days and you just want medication, this is a great appointment for that. We also offer the 24/7 nurse advice line. So if you ever have any trouble symptoms, you're unsure of what to do, you call the nurse advice line. It's at no cost to our members, and they'll provide you with advice, whether you should go into urgent care or maybe even tell you what prescriptions you can take over the counter. You can also email your doctor's office with non-urgent questions. They'll respond to you within 1 to 2 business days. And so if you want to send them a picture, maybe you have a rash on your arm for some time, they'll provide you with feedback and they'll respond to you pretty quickly. We also, if you didn't know, you're also covered for emergency and urgent care anywhere in the world. So we have a partnership with Minute Clinics and select CVS and Target stores where you can receive urgent care services while you're traveling. In addition, you could also call the phone number that's on the screen, and they can also help. They can also help you receive vaccines before your travels, or if you need to make sure you have enough medication for your travels, they can also help you with that. And in addition, we offer support for our members to make sure that you guys are thriving. It's not just about seeing your doctor once a year or twice a year. We offer ClassPass, which is virtual fitness classes. There's yoga, Pilates, and so many other different fitness classes that you can take advantage of and do them from the comfort of your home. We also offer the self-care apps, Calm and My Strength, at no cost to members. These are great for overall wellness and your mental health as well. We also offer wellness coaching. This is at no cost to members as well. And a wellness coach can help you to learn how to eat healthier, learn how to lose some weight, also manage depression, anxiety, any wellness goals that you want to reach, a wellness coach can assist you with. And we also offer reduced rates on specialty care services like acupuncture, chiro. We even have also discounts on gym memberships. You just have to go on kp.org/choose healthy. And we also have on-site health educational classes and support groups that you can take advantage of. A lot of them are at no cost to you, and you can also do them virtually. And lastly, we have online healthy lifestyle programs, healthy recipes, podcasts, and so much more on kp.org. So now that we went over the benefits, the resources available with your membership, let's now go over your plan benefits. So the plan being offered is a traditional HMO plan. This is a great plan. It does not have a deductible and it has set copays. So you always know what you're paying up from the very beginning. You have your out-of-pocket cost, which is $1,500 for individual and $3,000 for family. So that's the most you'll pay for the plan year. Your out-of-pocket maximum protects you in case you get sick, you get injured. Unfortunately, we never know what could happen. So that's the most you would pay, and that would protect you. Your preventative care is at no charge to you. So take advantage of your routine physical exams, cholesterol screenings, diabetes screenings, anything preventative is at no cost to our members. Doctor's office visit is a $30 copay, but remember, you can have a telehealth appointment, saving yourself that $30. Lab tests and radiology is also at no charge. Outpatient surgery is $30 per procedure. Hospitalization is $250 per admission. And emergency care is $100 per visit. And that copay would be waived if you're admitted directly into the hospital. You also have access to your prescription medications at Kaiser Permanente. Your generic is $10. Your brand is $35, and your specialty is 20% coinsurance, not to exceed $150. Offer up to a 30-day supply, but there are ways that you can also save money. You can order your eligible prescriptions through mail. You'll pay double the copay. However, you receive up to a 100-day supply. So a lot more medication, the shipping is free, and it's sent directly to your home. So if there are any questions, feel free to type it in the chat box and I'll be happy to reply to you. Thank you.
All right. Thank you, Katie. Next up would be Anthem Blue Cross. And do we have Sylvia on the line here?
Yes. Hi, everyone. Thank you. We'll be talking about your Anthem plans, which will include the HMO, PPO, HSA, as well as the vision plan. Next slide, please. With the classic HMO, this is a wonderful plan. There are some benefit changes. You have no deductible. Your coinsurance is not applicable on this plan. You do have a split office visit copay, $20 for when you're seeing primary care, and the specialist is now a $40 copay. Standard diagnostic lab and x-ray is covered at 100%. Complex imaging like an MRI or a CAT scan is $100. And for hospitalization, when you're admitted, this is another change in your benefit. It's $250 per admission. Outpatient surgery is covered at 100%. An emergency, a situation threatening to life or limb, you're going to get yourself to the nearest emergency room, which is $125 copay. There is a change to your out-of-pocket maximum. For individual, it is now $2,000, doubling for those of you with families.
I've left it open because
For prescriptions, important to keep in mind, For prescriptions, it's important to keep in mind that all the carriers have what they refer to as a formulary, which is a listing of medications they cover. So your Tier 1A, your more commonly prescribed generics, are going to be a very low copay. Tier 1B, $15. Now, when you have a Tier 2 brand name drug that is on the formulary, it is a $30 copay. Tier 3 means that the doctor has prescribed a medication not on the formulary. It's their responsibility to get the necessary authorization, after which it will be released to you at that $50 copay. Not too common, very expensive are the Tier 4 medications, which are specialty drugs. Here you're going to have a 30% coinsurance, which is capped at a maximum of $250. You'll also have the mail order program available to you. So if anybody is taking maintenance medication, which is medicine you take daily, long-term, you're going to want to take advantage of this program where they will mail the medication directly to your home, which is very convenient. You also have some discount. Also, please note that the benefits we're covering are your core benefits. So if you need more detailed information, you'll need to refer to your plan summary or your evidence of coverage. Really important to keep in mind with an HMO is that your primary care doctor does drive all your care. You do need referrals to see a specialist. If you're ever not happy with your primary care physician, you are able to change them up to 1 time per month for any reason. General rule of thumb, as long as you go online by the 15th of the month, the change will be effective the 1st of the following. You always want to make sure, if you have a specific doctor in mind, that you're selecting the medical group that's affiliated with that doctor, or if you have a hospital that you need, keep in mind that doctors and hospitals are all driven by their medical group contracts. So you do have primary care medical groups where you tend to have all services at one location, and then the independent practice or physician associations known as IPAs, where they refer you to different locations, again, within the same medical group. With the classic PPO, the beauty of the PPO being that you have total flexibility to see any provider that you like at any time. You are really maximizing your benefit and minimizing your out-of-pocket risk when you're in network seeing contracted providers. So there's been no changes. Some of the highlights are that you do have a $750 deductible as an individual. Your co-insurance, once you've satisfied that deductible, is 20%. When you're in network, you're going to have flat co-pays of either $30 or $50 for your doctor, primary care, or specialist, and no deductible. Your standard diagnostic lab and x-ray, as well as complex imaging, hospitalization, whether inpatient or outpatient, is going to be subject to that deductible, after which you have that 20% coinsurance. Emergency, again, situation threatening to life or limb, you're going to get yourself to the nearest emergency room. You have a $150 copay plus deductible and 20% coinsurance. For an individual, you do have a maximum out of pocket of $5,000, doubling for those of you with family. And we again have that formulary that will apply to medication. So there's really no changes there in terms of how it's structured. You always want to keep in mind, please, that if you do go out of network to a non-contracted provider, you are going to be responsible for higher deductible, higher coinsurance, and any balance billed amount. The HSA, or Health Savings Account Plan, allows you to put away money on a pre-tax basis. You can use this money to offset your deductible, and once your deductible is satisfied, which is required before the health plan begins to pay their portion, you can also use that money to roll it forward for the next year and save it. Again, no taxes paid as long as it's on eligible medical expenses. In network, you want to keep in mind that if you are enrolled with family, your deductible is going to differ. So if it's just yourself alone, you have that $1,500 deductible. If it's yourself with family, $2,800, and $3,000 for family. You have that coinsurance of 10%. And again, key here is that you're going to need to satisfy that deductible, including for pharmacy. before you have that 10% co-insurance kicking in. You have a maximum out-of-pocket of $3,000 for individuals, $6,000 for family. And on the prescriptions, I want everyone to note that your copay, again, will be applicable once your deductible has been satisfied. And if you're out of network, you may be responsible for having to pay that provider upfront and then afterwards file a claim. Again, richer benefits when you're in network. And the one comment I will make, that the only service that you're going to get that is going to be covered at 100% with no deductible on all these plan options with Anthem is going to be your preventive care, as long as it is in network. Your Blue View vision, so really important, if you ever injure your eye or you have a medical issue with your eyes, such as cataracts or glaucoma, that's actually going to be covered under the medical plan. Now, your Blue View Vision Plan is a true PPO. You can see any optometrist that you like at any time. We do recommend with this plan that you stay in network. You're going to have low copays, no claim forms, and when you're in network, your eye exam is going to be covered at 100% once a year. Your lenses, whether single, bifocal, or trifocal, are going to be covered once a year at a $25 copay. Your frames are covered once every other calendar year. The health plan pays the first $130 and then provides you with a 20% courtesy discount off the balance. They also have a number of discounts and enhancements that are available to you when you are in network. And if you prefer contacts in lieu of traditional glasses, those are available one time per year. If they are elective, conventional, non-disposable, it's a $130 allowance with a 15% courtesy discount on your balance. If they are elective disposable, then you have a flat $130 allowance. And if they are considered medically necessary, they're covered in full. Also keep in mind that if you do go out of network to a non-contracted provider, you are going to be responsible for paying that provider up front, and you're going to have to submit a claim form with your receipt, and then they will reimburse you at the listed amounts we see here. We highly encourage everyone, once you're enrolled with Anthem and have received your ID card, to register online. We're going to touch on some of the different benefits that are available to you when you are a registered member. When you're logged into your Anthem, you would simply go to the right-hand corner where you would log in with your username and password. If you ever forget these you're able to reset them by just clicking on Forgot Password, just like you would with any other site. This gives you access to a lot of information, including finding a doctor, local providers, prescription information, and claims activity. Once you have registered, you're going to be entering your personal information. As we see here, you can then set up your personal preferences, and you're confirmed that all the information is correct. Next slide, please. Okay. Once you're on your landing page, you'll be receiving a welcome message. Here, they have a tutorial, which is really great to use. If this is the first time that you're using this plan, you'll be able to see and take a health assessment, as well as complete your profile. You'll see messages here that are available to you.
Hi.
You'll see your plan design and who is covered with you on your plan. On your claims page here, you can see claims activity. You can see how much of your deductible you've satisfied. You'll be able to request ID cards, print a temporary card, as well as update other insurance information. And again, they do have that guided tour that you can take so that you're really getting the most out of different landing pages for the different services. You also have a number of health and wellness discounts that afford you savings on a number of health and wellness-related items. You can get even 5% off VPI pet insurance. They have grocery coupons that you're able to use. They even have some baby proofing tips and information through safebeginnings.com where you can access up to 15% off. And they even, for seniors, have a 25% off services. And this is for older adults as well as seniors. Infertility treatment is also a perk that they've got a 40% discount for affordable treatment available for anyone that is needing infertility services. They also have a 5% member discount for ASPCA pet health insurance. So a lot of information available to our Anthem members and discounts. If you need to look up a provider, you can go online, you can search as a member, which means you'd be logging in with your user ID and password. You can also go in as a guest. It's completely up to you. Please keep in mind, again, that when you are on the HMO, you can change your primary care doctor for any reason up to one time per month. And if you're on the PPO, whether it's the traditional PPO or the HSA plan, you're also able to go online and confirm that providers are in network, which of course saves you money. Live Health Online, as you can imagine, everyone right now is dealing with a certain amount of stress or anxiety. So you do have your mental health benefits that are built into your medical plans for all the options, but you can also access these doctors via Live Health Online. So this allows you to see the doctors from the comfort of your own home, and you can see psychologists, psychiatrists, as well as substance use providers. You can chat and have online chat therapy. This allows you to deal with stress, anxiety, depression, grief, panic attacks, any number of mental health and wellness related items. And this is completely confidential when you use this benefit. The travel assistance is customer support is also available to you on the website portal, and you can also access this if you go on the mobile app, which is called Sydney. Again, they have a huge library of resources, frequently asked questions, glossary. I know that sometimes we're using a lot of terminology when we're talking about healthcare, so this helps break it down. And again, this is accessible to all of our members. Travel assistance, if you are traveling, it's usually if you're traveling 100 miles or more away from home, if you need a medical referring or medical monitoring, they're there to assist. If you need some trips prior to traveling, what's going on in the country, they can also provide a lot of information. And they do also provide the benefit of medical evacuation and helping you return home if there's social unrest in a country you're visiting. Repatriation of remains. I know it's not nice to talk about this, but this is a really helpful benefit to have. They also have traveling companion assistance that's available and assistance for dependent children when you're traveling with children that are under the age of 26. Resource advisor, so Anthem provides resource advisor. This is at no additional charge to you. Again, completely confidential. You're able to talk to them face-to-face or through Live Health Online, video chat. We have the 800 number listed here, as well as their website information. On their website, they actually have a huge library of wellness information and resources that are available to you. These are unlimited in-person calls where you can speak to somebody if you're dealing with stress, parenting issues, anxiety, depression, any issue basically that affects your well-being. If you're dealing with illness, relationship or family issues, they're there to assist, including referrals for child care as well as elder care. So again, this is at no charge to you and available via online or their 800 number. Pay It Forward is a really great program where Anthem has partnered up with PayForward. You can get information via payforward.com or download their mobile app. What this does is it allows you to sign up, you link your credit cards, and you'll be able to earn up to 15% cashback rewards at more than 60,000 different retailers nationwide. So what you're able to do with these rewards, which does not impact your original credit card's rewards at all, is that you're able to shop, earn rewards, and you can then gift those rewards. You can gift them to family, friends, or to even a charity. You'll find additional information on our website as well as payforward.com. Well-being solutions, so good health is really worth it. I mean, we all do a lot to maintain our health, so this allows you to earn rewards. They have a suite of programs to help you with everyday health and well-being, so you can get tips, extra guidance and support, and you're able to earn up to $200 in rewards for being part of this program. So the well-being program, if you have a flu shot or you go in for a wellness visit, you can earn up to $50. So that's when you go in for your preventive care. You also can have activities that allow you to earn up to $150. For example, you log into the website or your mobile app, you'll get 10 points yearly. Every time you connect to a tracking device, you can earn points. They have a WebMD health risk assessment. Complete that assessment, you can earn 75 points. If you go into their resource library and watch some videos or read articles, a minimum of 5, you'll earn 25 additional points, and so on, as we see listed here. Again, these are rewards that you would earn. Sydney is Anthem's mobile app, so you're able to go online, download it, no charge. It gives you access to all the information that you would find if you went onto the website. So you'll see your health dashboard, you'll see your family health record, you can look up providers, see your benefit information, claims activity, as well as view and use your digital ID card. They also have an interactive chat feature so that they can get answers to you quickly. This is again available at no charge, Sydney Anthem's mobile app. Health and Wellness 360 is their health education and wellness program with Anthem. So you have a lot of resources. We do recommend that you go online or via the mobile app so that you know all these different sources that are available to you, which really help you get the most out of your plan option. They have a 24/7 nurse line. So if you're ever not sure where to go, what to do, you don't know if it's an emergency or urgent care, or you just have a question regarding a health issue, you can contact the 24/7 nurse line and they're there to assist. You also have a lot of wellness programs that are available to you. One of the more popular ones is for pregnant moms, the Future Moms program. This is just one of the many programs that's available with Anthem. They have classes, they offer tips, and there is no charge for using this benefit.
All right. Well, thank you very much, Sylvia. Great presentation.
You're welcome.
And
Thank you.
I noticed in the chat, we've answered a number of questions in chat, so I hope everyone got their questions answered regarding these benefits. All right, next up is Robert from MetLife.
Thank you. Good morning, everyone. I'll be going over your dental PPO as well as your DHMO plan. As previously mentioned, there have been no changes, so we're just going to highlight a few provisions of the plan and some additional pointers to help you out as you utilize the plan. So on the PPO, it's a very large network. There's a large number of dentists nationwide. You're going to have a great savings using this plan. The dentist will handle all of the claims, and you can actually look into what are known as pre-treatment estimates, real-time claims processing, and have access to 24-hour customer service. And we'll talk about those pre-treatment estimates momentarily, but let's go to the next slide, please. So here you see the two different columns, in-network and out-of-network benefits. So your preventive services are covered at 100%. And it shows there that going out of network, it's also covered at 100%. This can be a little bit confusing. So always try to go to someone in network, because when you go out of network, the dentist out of network is not contracted. So they can charge an amount, but we are only going to compensate them for what's reasonable and customary. Therefore, if the amount is in excess of what we deem to be reasonable and customary, then you would be billed that amount. Subsequently, it would no longer be at 100%. It would be at 100% of what we deem to be reasonable and customary. Having said that, again, best to go to a dentist in network. You can locate one by giving us a call, by downloading the app if you have a smartphone, or by going to MetLife.com and looking up that information. So basic services covered at 80, major services at 50%. We can go back to the slide, please. Sorry. Major services at 50%. Orthodontia is at 50% max on orthodontia for adults, spouse, children, the entire family. You're basically looking at $1,000, and that's lifetime. On your annual benefit, that is going up to $5,000 per year, resets every year, and the deductible is $50, and that is with a max of 3 members in the family meeting that. So if you have a large family, it's not as if everyone has to pay the deductible. Remember, you can obtain what's called a pre-treatment estimate in advance. So if you go in and they tell you that the amount is going to be basically in excess of $300, but they're giving you a ballpark figure, always ask for that pre-treatment. The dentist will go ahead and send us exactly the work that you need to have done. Within about a week to 10 days, you'll receive a letter letting you know as to how much the dentist will go ahead and be compensated and how much would be your provisions for that. So let's go over to the next slide, please. So here you see how you can find a provider. And so you can go to MetLife.com, search under dentist. If you are looking under the PPO, you're going to want to look under the PDP Plus network. And if you were to be looking under HMO, which we'll go into that momentarily, you want to look under what's called Met 100. That's the drop down that you want to find for dentists that are in the network. Also remember, if this is your first time enrolling, you're a new hire, it's important to locate a dentist in advance and use and locate their primary care number. They have a physician's number that is assigned to them. And you will need that to include that into the DHMO plan. The PPO plan, we don't need to know in advance. You can go to somebody in or out of network. You don't need to notify us. But on the DHMO plan, it's important because if not, you won't be assigned a dentist. And so we don't do what's called auto assigning, where just automatically when you enroll, you're assigned to a dentist on the HMO plan. But if you provide that dentist number, not phone number, but it's the number that you'll find once you look it up online on your app or giving us a call, then that would be the dentist assigned to you. And you can always change that dentist. You can change it up to once a month, not that you're going to do it that often, but you have that flexibility. Next slide. The HMO network, you're going to pay significantly lower costs. You're going to know exactly in advance what those costs will be. There's no deductibles, no annual maximums. Again, no claims forms to fill out. There are no out of network benefits, but if you're going out of the area and there is an emergency and you can't go to your local doctor, well, you do have coverage. And you have basically over 400 different procedures, which include anything from general anesthesia, implants, orthodontia, et cetera. Next slide. So here you see some of these procedures, and the preventive care, again, is covered 2 times a year for your cleanings and x-rays and exams, and that's at no cost. Again, this is the same as within the PPO. And then you have all the various procedures as far as porcelain and gold crowns, adult and child orthodontics, root canals, implants, surgery. It's fairly extensive. Next slide. How can you get in contact with us? Again, MetLife.com. You can give us a call at 1-800-GET-MET8 or 800-438-6388. And you can also use the app and website, as previously mentioned. I think that covers it. Thank you for your time.
Great. All right. Thank you very much, Robert. All right. So next up would be Sun Life. And do we have Sonia?
Yes, hello, I'm here.
All right, great. Sonia, go ahead and take it away.
Thank you very much. Hello, everyone. My name is Sonia Fernandez, and I'm your Sun Life representative, and I'm going to be going over quite a few benefits with you that include your life and AD&D, your short-term disability, and your long-term disability. So our purpose is to help members achieve lifetime financial security and live healthier lives. Life insurance, it protects your loved ones, helps pay for your final expenses, and allows you to leave a legacy. Why do you need life insurance? So a lot of us have our own personal reasons, but these are just some of the most popular responses we have received. Maybe you want to leave money for household expenses or hired help, financial support of others, or inheritance or philanthropic gifts, or shared debt responsibility. Maybe you're a co-signer or someone's a co-signer with you on a certain debt, or again, funeral or medical expenses. So the first benefit here, you do have your employer paid life and AD&D insurance coverage. AD&D is accidental death and dismemberment, and it's just an additional benefit included in your life insurance. It is available at no cost to you. Your employer pays the full cost of this benefit. So this benefit is a life insurance amount of $50,000. So at this time, we do ask you just to make sure that you're the beneficiary that you do choose or have chosen is the beneficiary that you do actually want to receive that benefit in your passing. A lot of people forget maybe throughout the year to change or update your beneficiary information, and it's left to an ex or someone that has already passed away. So again, it's also always super important to make sure that your beneficiary information is up to date, but that benefit amount is $50,000. How much additional life and AD&D insurance can you buy? So you do also have the opportunity to purchase additional life insurance apart from what the company already gives you as a free benefit. You, the employee, can purchase anywhere from $10,000 up to $500,000 in $10,000 increments. For your spouse, $5,000 to $250,000 in $5,000 increments. And for your children, you can choose an option of a $10,000 benefit amount. There are additional features of the plan. There is an accelerated death benefit, which gives you a specific percentage of that life insurance amount that you have purchased. In the event you are given, I believe it's about less than 12 months to live. So you are able to cash in a little bit on that benefit there. It is portable. So if you happen to leave the company for whatever reason and you want to keep this life insurance policy, you would just pay Sun Life directly. There is also a waiver of premium. So if you do become disabled, you are able to keep your policy and just not pay for that premium until you are no longer disabled. And there is an AD&D benefit, that accidental death and dismemberment benefit, which doubles the benefit amount to your beneficiary if you happen to pass away due to an accidental death. If you are in an accident and suffer a dismemberment, some of that money comes to you. So again, we hope that no one ever cashes in on this benefit, but again, accidents do happen. So it is great to know that you do have some money coming back to you if you are ever under a situation like this. Now we're going to jump into short-term disability insurance, and this is for non-California employees. So short-term disability protects your income, provides you with a weekly check, and helps you return to work. Why do you need short-term disability insurance? Again, it simply protects your paycheck and even your savings. So if you are disabled and unable to work and are not receiving any disability money or payments, you may have to dip into your savings or use your credit cards, etc. Take care of your family if you cannot work. Oops. Can we go back a little bit? Take care of your family if you cannot work due to a covered disability, and pay for everyday expenses. So what does your short-term disability insurance cover? It covers a disabling injury. And again, only a doctor can deem you disabled. It also covers you for those women for maternity leave, and then for surgery recovery as well. So how much, how soon, and for how long? So if you are disabled due to an injury or illness, you do receive 60% of your weekly income. And this is from $25 up to $1,540. Again, that's weekly. And you do begin to receive the benefit 8 days after injury and 8 days after illness. And you can receive this benefit for up to 12 weeks. Then we're going to move forward to the long-term disability insurance. And again, this disability insurance helps keep your life on track, helps you pay everyday expenses, and helps you return to work. So again, why would you need long-term disability? Simply the same reason why you would need short-term disability. It helps protect your paycheck and your savings account and for everyday expenses. What does long-term disability insurance cover? Again, if you are deemed disabled by a doctor due to an injury, disabling illness, cancer recovery, stroke recovery, or even heart attack recovery. And again, remember that the only one that can deem you disabled is a doctor. So how much, how soon, and for how long for the long-term disability? Again, it is 60% of your monthly income to a maximum of $10,000 per month. There is an elimination period of 90 days. After injury or illness, but mostly the way it works out is short-term disability comes first, and that satisfies that elimination period. Then you can receive these benefits for up to your Social Security normal retirement age or until the doctor says you are able to return to work. So long-term disability does last longer than short-term disability benefits do. Sun Life member support. So there's easy registration here. Create an account today at sunlife.com/create account. So this gives you immediate access to your plan. View or print your policy booklets, view claim status and payment information, even apply for evidence of insurability. So what I forgot to mention on that voluntary life insurance is you do have that guaranteed issue amount. So super important for all employees that are newly eligible to this benefit, and everyone, since we are a new carrier coming into your benefit world here. You are able to purchase up to $150,000 of life insurance, a voluntary life insurance with no health questions asked. Anything over that, you will have to apply for evidence of insurability, which means just answer some health questions and get approved or denied for any additional amount. But do take advantage of that guaranteed issue clause that's available to you only one time during this open enrollment. And again, if you do need to apply for that EOI, that evidence of insurability, it would be all in your account. Member services teams are also here to help you Monday through Friday, 8 a.m. to 8 p.m. And the number is 800-247-6875. Thank you all very much.
All right. Well, thank you very much, Sonia. That was a great presentation. So next up would be our Trustmark Universal Life and Accident Plan. And Andrew, are you there?
I am here. Good
All
morning,
right.
everybody.
I'll let you go ahead and take it away.
Okay, great. Well, good morning, everybody. My name is Andrew Parr from Trustmark. We're very, very excited to continue our partnership with the organization. So we're going to be re-enrolling 2 of our benefits, Universal Life with an emphasis on long-term care, as well as our accident coverage. You can go to the next slide. Great, so this is our friend Charlie. We're going to use Charlie as an example for both benefits. Charlie is 37, he's married with 2 kids, he has a cute little dog named Lucky. For his occupation, he manages a hospital shipping department. And Charlie wants to make sure his family is protected for life no matter what happens. Because while he's pretty good at controlling shipping costs, he knows he can't control everything. So even if something were to go wrong, he suddenly is not around, those expenses that Charlie has do not go away. So the normal expenses that life insurance would cover are things like funeral and burial costs, rent or mortgage payments, credit card bills, medical expenses, etc. So while the life insurance is a very important part of this policy, I think what's very unique about this is that it includes a long-term care component. So when you think about long-term care, most people think of nursing home, assisted living, kind of the end-of-life type of stuff. However, most of our claims are actually for people under the age of 65. So even though Charlie's young and healthy, he was in a car accident and survived, and he needed long-term care services. If you didn't have a long-term care policy, those services can cost hundreds of dollars per day. Luckily, since he enrolled in our universal life policy, he has the full long-term care benefit. and it will help pay for some of these services. The next slide will show an illustration of this. So he had a $100,000 policy. And the way the policy works with the long-term care rider is that it pays 4% of the death benefit for up to 25 months to help pay for the long-term care services. So with Charlie's policy, that would be $4,000 a month paid to him directly on a tax-free basis, which he can use to offset his long-term care expenses. Also, a very nice feature in this policy is that it has benefit restoration. So even though he's using $4,000 per month, his full death benefit is still available for his beneficiaries. So it's a very, very nice value there. Next slide. So this is a unique plan as well. So this is for the employees under the age of 65. They will have the universal life events. Essentially what that means is that at his age, when he turns 70, the life benefit will reduce to 1/3. However, his long-term care benefit will always remain the exact same. So 4% of his original life insurance amount. Next slide. There's also an easy value component which you can opt into. This is very nice. So every year on the anniversary date, the monthly premium.
Yeah.
So this ensures you that you can increase your benefit every year on a guarantee issue basis. It will basically increase by $1 of weekly premium, and whatever volume amount that gets you, you'll be automatically issued that amount. So you can see an illustration here that someone enrolls in a $25,000 benefit initially. After 5 years, the benefit could go all the way up to $47,000, et cetera. Next slide. So this is the option. Even if you're over the age of 65, you are still eligible for the plan. You will have our traditional universal life coverage, which basically means that there will be no universal life events. So your coverage will basically remain intact, for the duration of the policy. It will be a little bit more expensive, but you still do have that option to enroll after the age of 65. Next slide.
Andrew, I had a request. If you can go over the restoration benefit again.
Yeah, absolutely. Great question. So the restoration benefit is in place to protect essentially your life insurance benefit. So if you enroll in this coverage, say you have a $100,000 policy and you need to have long-term care, you're going to get 4% of that death benefit. So you could receive up to $4,000 of a long-term care benefit for up to 25 months. However, the life insurance will always remain the same because it will restore every year on the anniversary date. So it's just a way to kind of protect, the life insurance component of the policy.
Okay, great.
Great question. There's also an oh, sorry, go ahead. Was there another question? No. Oh, okay. There's also accelerated death benefit.
Sorry, these city stores who like to talk down. Salesman.
That didn't come through very clearly. Could you repeat yourself, please?
It's possible they were just talking in the background. So again, I just want to remind everybody, if you're not talking, please mute yourself.
Okay, great. There's an accelerated death benefit. So essentially, if you could take 75% of the death benefit if you have a terminal illness with a life expectancy of less than 24 months. Next slide. There's also a waiver of premium included. So you can waive your policy payments if the doctor says you're totally disabled prior to age 70. And there's also an accidental death benefit, which will double your death benefit if you die in a covered accident before the age of 75. There's also child coverage available. So you never want to think about life insurance for children, but it's always good to have some just in case. This will allow you to put two options. You can either put $5,000 or $10,000 of coverage for your child. And just some advantages of applying through your employer. One that's very unique is that these are issue age. So that means that your rate will never increase due to age. So if you're younger, you're thinking about, do I really need this type of coverage? I'm very healthy. Just know that if you're 25 years old, 26 years old, you enroll, you will have that same rate all the way for the duration of the policy. The payments are deducted out of your paycheck, so very convenient. And it's fully portable, so you can keep your coverage at the same price if you were to change jobs, retire, etc. Great. The next product is accident insurance. So we will use Charlie as another example. Charlie just can't keep himself out of trouble. He ended up having a broken leg, and even with a very good medical plan, there's out-of-pocket expenses that kind of pile up when you have to go to the emergency room. You might need surgery, etc. The average cost to treat a broken leg is actually $9,300. Now that's, again, dependent on what type of medical plan you have. But if you look over at what Charlie did on the next slide here, his accident insurance paid cash benefits directly to him for his troubles. He got a payment for the broken leg, another for the ambulance, another for his hospital admission, and so on. All of his payments came regardless of what his medical insurance paid for this treatment. So it's totally separate. Again, these benefits are paid to the insured directly on a tax-free basis. And Charlie used that money towards the copays, deductibles, and also towards some new, safer softball cleats, all thanks to his Trustmark accident insurance policy. And here's just a kind of a nice little overview. There's actually a covered schedule of benefits that includes much more than this, but some very common examples would be hospital admissions, ambulance transport, physical therapy, follow-up treatments, some covered injuries, fractures, disclosures, burns, concussions, things like hernias, all things that can happen to somebody who's very active and healthy. This coverage is for 24-hour coverage. So that means it covers you for accidents on or off the job. They also pay independently of any workers' compensation. There's a $50 wellness benefit included. So essentially, if you get there's over 26 different covered tests. A lot of these are covered free of charge, if they're deemed wellness. Again, that's specific to your medical plan, but things like mammograms, colonoscopies, prostate specific tests, routine physicals, ultrasounds, immunizations. I have a policy. I just got my annual physical, and this actually pays you on an annual basis once per calendar year, $50 as paid to you directly. It also covers you for your entire family. So if you have 4 kids and a spouse, it's going to cover you, 50 times 6. So it's a really nice way to offset your premiums. And it also helps us keep our insureds healthy. So we're very, very happy to pay these benefits out. There's family coverage. So you can apply for coverage on yourself. You can apply for coverage on you and your spouse, or you can apply for the entire family plan. So that'd be one rate, and monthly cost covers all the members of your family. So that'd be your spouse, dependent children, etc. And again, just some nice things about enrolling at the workplace. Your rates will never increase. Payments are conveniently deducted out of your paycheck, and this benefit is also fully portable, so you can keep your coverage at the same price whether you leave, retire. We'll just bill you on a direct basis upon porting. Great. Well, thank you very much. I see there might be a couple questions, but I've told Ross that you guys can all reach out to me directly if you have any further questions. And again, we just very much appreciate your partnership.
Yeah, one question, Andrew, someone wanted to know, is there a discount on the Trustmark UL long-term care for adding a spouse?
That's a great question. There's actually not a discount. So there'll be, you have to pay for you and your spouse as the rates are outlined on the enrollment portal.
Okay. All right, great, very much. If you have questions, again, like Andrew said, he'll be available. And you can always reach out to the Leavitt team, and we'll make sure we get your questions answered. All right. So with that, next up would be Legal Shield. And again, thank you, Andrew, for that presentation. So Nancy, are you there?
Yes, I am. Thank you
All
very
right.
much. I'm glad to be here. I looked up my records. I've been helping you with this for almost 18 years now. And we have 2 powerful benefits that we offer, Legal Shield and ID Shield. And if you click the next one, I'm going to start with the rates. We'll go over the details in my 5 minutes, but I wanted to focus on the rates because this plan has been rate stable since I started with you 18 years ago, and they have kept the stable rates for this year's open enrollment. it most likely is going to go up next year. So I wanted to bring your attention to not only are the rates stable, but you've been grandfathered into the old group rates, which is pretty amazing. So we're talking about $736 a pay period to have the Legal Shield program for your entire family or an individual. The ID Shield for an individual is as little as $413 a pay period. And that these same rates, and for the combined rates, there's some benefits for bundling the two together. So if you just have one, you could actually upgrade because the family price is $1426, but the individual price is $1149. So the family price is discounted and the individual price is upgraded to the three bureau identity theft shield for just the same price as the one bureau. So that $413 bundled together with the legal plan is pretty amazing because that $413 retail would be $1495 retail. So that it's pretty amazing. The legal plan would be almost $30 retail. So this is the year that if you're interested in our services to lock in for this year at those prices. And I'll go ahead and do the next slide and I'll go on. I wanted to mention, it says PPLSI on my background there. That's because the name of the company they've gone back to their original name, Prepaid Legal Services, Inc. So if you're already members or you become a member, you might be getting emails from PPLSI. I wanted you to know what that was. So, basically with our smartphone app, and the app actually has been upgraded and the logos are different, but it's all the same. We've kept everything the same from last year. Wherever you have your phone, you're going to have your firm. You'll have lawyers in every state, in every area of law with unlimited number of issues without a clock ticking. And I'm just going to time myself so I didn't go over. And letters and phone calls written on your behalf. You can review all your documents before you sign them, up to 15 pages. If you're audited on this is personal. If you're audited on your personal IRS, then you can have actually representation for that and representation if somebody sues you. It's very simple now on the app. You just can make an appointment on your app. You don't have to wait for them to call you back anymore. You can actually schedule an appointment on your break. Okay, next slide. And traffic tickets still covered. It has to be defensible in California, some of the other states not. And they will consult you within 4 business hours. You email in the ticket through your phone. And we also have really important that you've got an emergency button on your phone 24/7 if you're being arrested, detained, questioned, a tragic accident, something like that. Okay, next slide. And I want to mention that all of this in more detail is on your web portal. It'll show up at the end, but it's, I'll show you the link at the end, but you can go learn a little bit more and see some videos and so on. I'm just giving you some highlights again today. The will preparation is my most favorite part because 8 out of 10 Americans don't have a updated will, power of attorney, and health directive, and we will prepare that for you for free and a 25% discount for a trust. Next slide. Yeah, those are all the things, even that they've added the financial power of attorney as well as the healthcare. So those of you that are members on the line, I know there's many, please reach out to me and I'll help you get more value from your membership. Next slide. Okay, for those things that go above and beyond, there's a 25% discount. What that means is you can start out getting unlimited consultation and document review or a letter written on your behalf on really any issue. But then if you have to hire the attorneys beyond the things that were covered for representation, but you won't have to pull out your checkbook until you get some advice and help. Next slide. Okay, so you're covered, your spouse or your domestic partner. And for the legal plan, all your kids up to 21 living at home, 23 full-time college. And if you have any dependent children, if you're the legal guardian up to 18 or any age, if they're physically or mentally disabled. So we cover an entire family for that $15.95 a month, $736 a pay period. Okay, next slide. So our second service is the ID Shield. And here's what sets us apart from everything else that's out there. I think we cost less, even the retail prices, we cost less. The group rates that you have grandfathered in are pretty amazing for $413 a pay period. But what sets us apart is we monitor what is important, all these things that you see on here. And we have an app as well for that, and you can get your alerts on your app. Next. This is the main thing that sets us apart. I don't know of another program that has licensed private investigators that do the work to put your life back together, plus the $1 million protection policy if you should be out because you've lost work time or you have some expenses. But they will do whatever it takes as long as it takes to restore your identity to the pre-theft status. And when you are in the middle of an identity theft crisis 24/7, it's so great to be able to have an app on your phone to just press. This happened to me once, and I was able to have a fraud alert on Christmas in the middle of the night, put at midnight on my credit policy. Okay, next. And I wanted to mention that cybercrime has been up since COVID 400% and maybe even more. So this is the time to take advantage of that. So the coverage is different. For the ID plan, your kids are covered up to 26 living at home, full-time college. Okay, next slide. So that's pretty much it. Again, here's the website, legalshield.com/info/LifeCare Assurance. I'll put it in the chat as well. And the most important thing is I'm available. I've been with you 18 years and I'm here to answer your questions, help you, and make sure you're getting the most out of your membership or upgrade anybody that they need. So please feel free, even after hours and on weekends, to give me a call. And the last thing I want to mention is that we have member perks, and I want to make sure the members are using those member perks to get, there's 400 to 500 corporate discounts. This is just something that we give you at no extra cost. So again, thank you for letting me share and be part of your team again. And I look forward to talking to those that already have it. And yes, it is a national plan. You have access in all states in any area of law. And it's available if you live outside of California. So if I didn't keep putting your questions in the chat, I'll look around a little bit more.
Right.
Thank you again. Appreciate
All right.
you.
Well, thank you very much, Nancy. That was wonderful. And congratulations for being with LifeCare for 18 years. That's remarkable. All right, so next up is nationwide pet insurance. And we have Rosa Aguilera from my office, who's going to go over this pet insurance with you. So Rosa, go ahead and take it away.
Okay, thank you, Ross. Good morning, everyone. Okay, so we do, Nationwide is as well offering pet insurance this year. I know we all, during COVID, did adopt a lot of pets, but this is a good opportunity to remember that your office does offer at a very good rate nationwide pet insurance. You do have the ability to offer an option to select one that reimburses you at a 50% or at a 70%. And it's very good to know that you have insurance for your pets, and good to know that you're not stuck with a particular network. There are no networks, there are no pre-approvals. You would just simply contact Nationwide Pet Insurance either by phone, or you can use their website below there on the screen and get a quote to see what it would cost to insure your four-legged love baby. And also too, if you pay once you pay out of pocket, it's a simple reimbursement. You submit your claim and then you get reimbursed. And also on the screen, you will notice what it covers. There's some highlights there to review what it does cover. So I know we'd like to all keep our babies healthy, so this is a good opportunity. You don't need to wait for open enrollment to enroll in the plan. You can enroll at any time. So if you haven't done so and have been looking to do so, you can do it at any time. You can do it today if you'd like to. Okay, so I'm going to go ahead and if you have any questions about Nationwide, feel free to reach out to me, and I can go ahead and get you in contact with somebody if you're having issues getting in contact. So I am going to review your flexible spending account as well. As you know, a flexible spending account is designed to reimburse you for medical care expenses. The account is set up for you by your employer so you can pay for a variety of healthcare needs. The account is funded entirely by a pre-tax income, so that's great to know. The limit has increased for 2022 to $2,850, so you can put those funds aside on an FSA account to pay yourself back for medical expenses. You do receive a Visa card that you can use. If for some reason the transaction is not going through, you can always save your receipt and upload that on the PayFlex website, and you can get reimbursed. You do run into sometimes those situations where it doesn't link, so it rejects the transaction. So don't be alarmed. You can get reimbursed simply by uploading that claim. As well, the FSA does have a dependent care. For a single person, you can contribute up to $2,500, and for a married couple filing jointly, your limit to contribute is up to $5,000. So if the money can be used to pay for eligible out-of-pocket dependent care expenses for day care, camp, after-school programs, now that everybody's back to school, for dependents under the age of 13, also your spouse or dependent who is incapable of self-care while you are at work are also eligible. There is a website here that I indicated for PayFlex. You can go ahead and use that. It gives you good information if you want to get a little bit more information how it works. There's some really nice videos that explains the healthcare FSA as well as dependent care. There is also a FSA store that you can actually go in there and purchase items if you are getting close to the end of the year and you still have quite a bit of money in there and need somewhere to spend it. You can always purchase items in there in the FSA website link. Okay, next screen, please. Okay, and GoodRx. GoodRx, we definitely like all of our clients to be aware and all their employees to be aware that GoodRx and single care are a great option, especially if you are in an HSA plan where everything's first dollar. You do have the access to GoodRx and single care to just go in there, type in the medication, and see what that will cost you at a nearby store. It could be Costco, it could be Walgreens, CVS, Target, inside Target, CVS, and you can see what that would cost you without using your actual insurance card. So this is a discount program. It's not an insurance, so you don't need to register or anything. All you would simply do is just go in there and type in the medication, the dose, the milligrams, and it will give you information based on your zip code that you enter. So I've used it. It's a great tool to have. And even if you're on HMO or a PPO and just curious, what that medication might cost you if you didn't use your insurance plan, it doesn't hurt to take a look. So feel free to let your friends know, family members know, because you don't need to sign up or anything. Just go in there and type in GoodRx or single care and look to see what that medication would cost you. Okay, next screen, please. Okay, and best practice to maximize your coverage. We'd like to just remind you that you can save money on doctor visits by simply utilizing what your Anthem and your Kaiser plans offer. If they're not available, you can always use the walk-in clinics for Anthem, urgent care as well, and emergency rooms. Target is one that does accept as well as Kaiser. They do accept members for walk-in clinics at the CVS So that is a good option if you can't make it to the urgent care, or it's something simple that doesn't require an X-ray, or you're not bleeding out or anything like that, but something simple. So, and also too, urgent care, if at all times you can avoid going to the emergency room, utilize your urgent care copays versus using the emergency room. But if you do have a life-threatening situation, definitely go to the emergency room. Your life is worth more than a copay. So definitely make sure that you use these services as much as possible, especially those that have HMO. If you're not familiar with urgent care that your medical group is affiliated with, make sure that you do inquire or go to the app and look for that urgent care facility that you can be seen at. Okay. Next screen, please. And just some action items for you to do. Decide to enroll in a medical plan or change dental, vision, short-term disability, long-term disability. That one's no changes there. Life and voluntary plans that you would like to enroll in this upcoming open enrollment. So make a decision, analyze what works best for you, as well as research your providers. If you're looking to change, make sure that doctor is in the network. If they're not in the network, feel free to reach out to us. Sometimes the directories on the portal are not updated, or sometimes these doctors are contracted and they're just not showing up, and I would be happy to inquire on your behalf. Feel free to reach out to me. Third, if you're not considering enrolling and you'd like to waive yourself and one of your dependents, this is the time to do it, as Ross stated earlier when we first began the meeting. If you want to remove a dependent, you want to enroll, this is the time to do that. Fourth, complete and submit online enrollments by Friday, August 19, 2022 to Libby. Next screen. And any questions, please feel free to contact Libby or myself, or Libby will contact me. And we really appreciate everybody's time. And again, this meeting is being recorded, and we will share this with your office. If you have missed anything from this meeting, we can go back. If nothing in there answers your question, feel free to let Libby know, and she'll let us know, and we will get back to you with an answer. Thank you, Ross.
All right. Well, thank you very much, Rosa, and thank you, all of our carrier representatives. We really do appreciate you taking the time out of your day today to speak to all the employees at LifeCare. As Rosa mentioned, this has been recorded and this will be made available. We will be sending this over to Libby, who will make this available to everyone out there. So with that, I know there might be some additional questions, but we did want to promise everyone we would be done by, well, we had indicated we'd be done by 10:15, so we're just a little bit over. But with that, we're going to go ahead and sign off, and thank you very much again. And thank you for allowing Leavitt and our team to work with you. We thoroughly do appreciate it, and we do appreciate it very much. And we're happy to work with everybody at LifeCare. All right, with that, I'm going to say goodbye and have a great day, and we'll see everyone later.
Okay, thank you, Ross.
Take care. Be safe.
Thank you, everybody.
Thank you.